So just a brief introduction that the robotic surgery actually is a combination when the patient and surgeon demand for invasive procedure advances with the computing power and robotic engineering. So it is the mix of engineering with surgical skills. So what it is actually, robotic assisted surgery is actually just a simple definition. It is a computer assisted surgery that uses motorized control with its end effectors. Now it has been used since I think 2008, early 7, 8, early 2000. In mostly it has been used in general surgery, gynecology, vascular surgery, cardiothoracic surgery, and has been used in our reconstructive and plastic surgery being very minimal. Just historical perspective, the first robot used was Puma 516 assembly line robot, but what we used first medical application was used by in Imperial College London by a urologist for making the resecting the prostate. Now, the what we all understand, the only thing I know before robotic surgery was D1C robotic system, which we all I think that's a familiar one, which is being used by general surgeons doing a lot of the hepatobiliary, laparoscopic, and these surgeries. So, if we come to use of robotic surgery, there is some limitation in plastic surgery. As in, I have gone from the study that human wrist has 7 degrees of freedom, while in laparoscopy we use 4 degrees of freedom of the human wrist. And in D1C robots, is what the principle of that is the visualization of patient in 3 dimensions, 3D, and using the number of end effectors and movement capabilities of human wrist. Now, scaling down the effect of the surgeon movement end effector, normally we have to bypass the tremor, physiological tremor in using endoscopic tools. So its use is limited because a lot of plastic surgery, reconstructive surgery is involved microsurgery. So I've got very nice paper. It's about 6-7-year-old paper in the Japares. He actually studied is from USA. He did a very nice systematic review of use of robotics in plastic reconstructive surgery. So my now talk is just, I was surprised that there is a lot of studies. He has identified about 1809 studies in which they have used about 95, get out about 41 articles which have mentioned the use of robotics in plastic surgery. So this is just a glimpse of what you will be surprised that there are almost, by the time of 2017, almost 114 reconstruction has been performed by robotic assisted surgeries. And also there are 42 flap harvests, 34 thyroidectomies for Fajar, because that's also a surprise for me, robotic assisted thyroidectomies. And then nerve repairs were done, ciliotectomies also in the head and neck field. And there were 89 cases they have used the robotics for free pedicle and local flaps. So what the study has identified that the average operative time was about 3 hours. Robotic setup time was about 34.7 minutes. That was average time. Blood loss was minimal as well. So this is one of the finding utility of that. So we will be happy that there was almost 43 flaps like local muscular mucosal flap. That's for the oral reconstruction. Then radial forearm were harvested. And there are few ALT as well as some radial forearm also harvested through the robotic surgery. This is by 2017. Now, one of my colleague is from UK. He's going to present today the DF harvest through robotic, which is one of the advanced. That's why I've got him. So I'm struggling to get him into sharing his screen so far, but he will be hopefully will there. So now the feasibility which I studied, because the plastic surgery, microsurgery is one of the essence of the complex part of the surgery in which there is need to some instrumentation or motorization to help in getting it well. So what they have studied that assembling and disassembling vascular clamps, they have used it in robotics to do microsurgery. But they have struggled in getting some bending needles while doing that microsurgery. But they still there are, I last slide showed, they have done about 7-8 vascular repair and nerve repair. That's initially in 2017. I think now they are using in some places in USA robotic assisted microsurgery as well. Because there is one problem is that the physiological tremor which has to be which is being involved in the case of microsurgery will affect the results. So that's why they are very cautious in using that in microsurgery. So what I will say, just a brief of that, what the reconstructive robotic surgery helps. It gives greater surgeon comforts, mobility while operating, improves the functional result, and however there is increasing operative time because it takes time to set up the instruments and then get it work. And also there is need to develop special robotic end effectors. They are the limbs which are used, end effectors, which can help and standardize to be used for microsurgery or for refined reconstructive surgeries. So now I come to just a brief outlook for the robotic surgery, and now introduction of the artificial intelligence. Now this is one which is the in thing. So I've got a nice video at the end. Just going to brief about the theoretical aspect of artificial intelligence. It is a technology that simulates human cognition, including interpretation and analyzing complex data to solve problems. So it has been applied in facial recognition, speech conversion, and search engine recommendations. So I think a lot of the students here must have used Chat GPT, so they know. So actually, what is that? It helps a therapeutic decision-making process having certain degree of variability, uncertainty, and errors if done by human. While AI helps to overcome the limitations of human behavior in decision-making and reasoning. So in discipline like plastic surgery, which is very diverse, we got almost deals with every part of the body, and there is the complexity is uh, quite in the plastic surgery. The AI technologies still have a limited use, but can be applied in pre-operative consultation, diagnosis, therapeutic decisions, post-op patient evaluation, and follow-up. And these gadgets are helpful in reducing the medical errors, improve work efficiency, and decreasing resource waste. Because most of time in plastic surgery, diagnosis is not a big problem. So it's use a little limitation that side. But in decision making, especially which flap to use, which planning or management has to be used, this AI can come very handy in that. So I want to show you, this is the like different examples of using the AI. Like for post-op monitoring and follow-up, we have mobile apps showing different software which can be used to do monitoring, like monitoring the blood pressure, pulse, especially in the flap monitoring as well. Pre-operative, we can use, especially in rhinoplasty, facelifts, and like stuff like that. We use the simulation techniques to use making a pre-operative scene for the patient, and also aid in diagnosing and pre-operative evaluation of few of the lesions, especially some skin lesions or dermatological lesions about diagnosis, because it has data of all the different and complex condition in it, and then it try to analyze it. And then in surgical decision making, especially in flap harvest and stuff like that, and management. So I'm just going to do small video, just briefing about the artificial intelligence, especially for the children here. By the time it is set up. YouTube. Artificial intelligence, or AI, is taking the world by storm. It is impactful in all corners of society, including medicine. AI will transform dramatically. Doctors involved, medical insider platform. The first way AI is changing medicine is diagnosing and treating patients. Misdiagnosing disease.
एक ईमेल एड्रेस उनको सेंड कर दें, उनको कोई ईमेल एड्रेस सेंड कर दें। ये देखिए,
Yeah. Actually, I'm logged in again as Dan. Please make me a host.
मैं होस्ट बड़ा बना देता हूँ, लेकिन उनको को मीन वाइज ना इस पे आप अपनी स्लाइड अभी सेंड कर दें। मैं यहाँ से स्लाइड चला दूँगा, तो
यार मुश्किल काम नहीं है।
नहीं कोई मसला नहीं, काम है ये उनको फॉरवर्ड
नहीं तो ये देखने का I'm logged in
मैं
again as
बना
Dan.
देता हूँ,
Make me a host.
मैं बना देता हूँ, कोई मसला नहीं। उनको ये ईमेल फॉरवर्ड करें, जो मैंने अभी आपको सेंड किया, उनको ईमेल फॉरवर्ड करें, उनको
उनसे कहें कि इस ईमेल एड्रेस पे अपनी टॉक जो है ना वो सेंड करें। ठीक है, मीनवाइल आप दूसरी टॉक्स जो है ना करते रहें, हम उसको सॉर्ट आउट करते हैं।
थिएटर भी जाना हमें।
ये वैसे पहले करने वाला काम है।
ओके क्या हो गया?
क्यू डॉट कास्ट
वो सबसे टाइम
क्यू
होना
डॉट
है।
कास्ट क्यू डॉट कास्ट क्यू
टाइम होते हुए ना
डॉट 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 विकास
दिखाएं।
कोर्स
मैं बना देता हूँ।
पहुंच ही करो यार।
मैं बना रहा हूँ
Post
बना रहा हूँ
as done. पहले
खाली डन है
10
ठीक है
5 मिनट है।
पेन के नाम खाली डन और स्लाइड एट अ टाइम वन शेयर हो सकती है यहाँ से हम क्रॉस करेंगे फिर वो शेयर कर सकते हैं स्लाइड ओके तो चेक करें जरा यहाँ से हम जब क्रॉस करेंगे स्लाइड से और यार प्ले करने का
हाँ आ रही है। ठीक है आवाज़ तो ठीक है।
तो यार ठीक ठीक कुछ नहीं होता चौधरी यार जाने दे छोड़ दे तो कुछ नहीं होता चुप कर आगे बैठ
अगला हो गया बता दो अगला हो गया इज रेडी। हाँ हो गया आ गया कि नहीं
पोस्ट हो गया
वो शेयर हो गया शेयर हो
शेयर कर देंगे जब हम यहाँ से स्टॉप करेंगे ना
ठीक
तो
है
वो शेयर करेंगे
चलो शेयर करें स्लाइड।
जब हम यहाँ से करेंगे स्टॉप शेयरिंग फिर वो शेयर कर सकते हैं एट अ टाइम वन हो सकता है
है वही कर रही हाँ नहीं उनकी बारी बारी भी उनकी उन्हें थिएटर जाना है बच्चे वास्ते इंटरेस्टेड लाए कुछ और बोर जी रहा है
सेंड कर दी सर
आपको ईमेल किया है क्या आवाज़ आ रही है? वही कर लेंगे, वही कर लेंगे, हाँ वही कर लेंगे। हाँ नहीं वही कर रहे हैं, वही ऐसे ही। इधर आ, मेल ड्रॉप भेजिए ना।
बिग फाइल रिपोर्टिंग है।
वहीं भेज रहे हैं मेल पे। रख सनिया सर, हुसैन साहब
स्टॉप कर
नहीं भी नहीं प्यारे खत्म तो करना बच्चे यहीं तो सुनना है। हाँ हाँ बस खत्म कर दो। आवाज़ में ठीक है। अच्छा आगे लगे अगली स्लाइड में नहीं अगली स्लाइड या so just briefly that AI has been increasingly applied in healthcare setting, prompting the development of pre-operative evaluation, prognosis prediction, patient management, post-operative monitoring. As you have seen, I try to explain for our students here, especially what they want to know the essence of artificial intelligence. But it is for plastic surgery, especially, it still is in a very infancy stage, initial stage. We're using it in few gadgets, especially in the pre-operative diagnosis. But it's it's a good tool for plastic surgeon to fully understand, apply these technologies, solve several clinical and research problems. And at the end, what we can say is AI gives a good, safer, and efficient medical tool in the future. Thank you. नहीं सर मैं
ਉਹਦੀ ਸੀਟ ਲਓ
और बंदे तो लाइए लाओगे
बट ठीक है इसमें मार्शल
Our next talk is by Professor Dr. Zubair and Bhatti, another energetic and a very dedicated plastic surgeon from Embark University, currently heading plastic
मेरा
surgery
सीनियर
unit
स्टार्टिंग
in
ऐसे
Leo Hospital.
सारी सब
He also holds the honor of singular PhD
विभा बता
plastic
हाँ
surgeon with special
थोड़े तो हर
interest
शिगिर
in
से एक तो एक बात
stem cell therapy, and his dedication to research led him also to write a book that is research methodology and basic biostatistics. And he also has many
अच्छा वो सेटल हो गए बच्चा बच्ची सेटल हो गई है
नहीं इंशाल्लाह नहीं सितंबर से जाना है
अच्छा
सितंबर जाएंगे
अच्छा
सितंबर